The UK has seen its biggest day-on-day increase in coronavirus cases, bringing the total number to 87.
Almost all of the 36 new patients had recently traveled to affected countries or been infected by others who had done so, the UK's chief medical advisor Professor Chris Whitty said.
But it is not clear how 3 new patients in England caught the virus. Meanwhile, it has emerged that 2 patients at King's College Hospital have been diagnosed with the virus. Of the 87 cases in the UK, there are 80 in England, 3 in Scotland, 1 in Wales and 3 in Northern Ireland.
2 of the latest patients are Scottish, with 1 living in the Grampian area and the other in Ayrshire. 1 had recently travelled to northern Italy, while the other had contact with a known positive case. New cases of the virus in England have been confirmed in Liverpool, York, Carlisle, Newcastle, Torquay and Manchester, as well as in Lancashire and Derbyshire.
In Northern Ireland, a Queen's University postgraduate student, who recently returned from northern Italy and has been mixing with fellow students, tested positive.
Professor Whitty, who earlier said an epidemic in the UK was likely, said people who had been in contact with the new patients are being traced. In the worst-case scenario, up to 80% of the UK population could be infected with coronavirus, which causes the disease COVID-19, he said. But he said a move to lock down entire towns and cities across the UK would be very unlikely.
A major public health campaign urging people to wash their hands regularly for at least 20 seconds has also been launched. Health Secretary Matt Hancock said washing hands regularly was the single most important thing that an individual can do. Public Health England says to use a hand sanitizer with at least 60% alcohol if soap and water are not available, advising that hand washing is particularly important after using public transport.